The unhappy triad is when you're running along in football or rugby, I think this is rugby, or Australian rules football, whatever, and you plant your foot, and if somebody hits you from behind, and it drives your tibial, if this is the femur and here's the tibia, it drives the tibia forward. Remember, it's the ACL that prevents the forward displacement of the tibia. So with a clip injury, which is what this is, what this guy right here, right there, is going to wind up with is a torn ACL, because it's the medial collateral ligament that's going to stretch right there. He's going to have a medial collateral ligament tear, and because it's attached to the medial meniscus, he's going to get the meniscus. So this is the unhappy triad. This is a displaced knee. I've never seen one of these. It's obviously going to require significant mechanical force to dislocate a knee. I would probably take that to surgery and not try to reduce it into ER at all. Here's osteoarthritis. Here's a normal knee. You see how the joint space there is even all the way across. The edges of the bone are nice and sharp. Over here, you see they're ragged. The joint space over here is exaggerated and decreased over here. So this is osteoarthritis. You know that osteoarthritis is going to be a chronic condition. It's not an acute thing. So if a person comes in complaining of, this started 2 weeks ago, it ain't osteoarthritis, right? Clinical considerations, pulled hamstrings. You know, you're stretching the tendon. That's all you're doing. Quadriceps strain, same thing. Know though that you strain muscles. You sprain ligaments. A sprained ankle, a strained muscle tendon. Iliotibial band syndrome, I think I mentioned this some yesterday in lab, where you can get an inflammatory process going on with it. The IT band, which is nothing more than a thickening of the fascia lata on the lateral thigh. The way you inject these is actually kind of horrendous. You've got your steroid and marcaine anesthetic. You inject it all the way down. And so it takes multiple injections to get relief if you're needing to go beyond just Motrin. Veins, the superficial veins, if they clot, it's no big deal. They do not embolize. So remember that guy with the sickler with that thrombosed great saphenous vein? No worries. They just don't break off from the superficial vein for some reason. The deep veins, however, do. Deep vein thrombosis, if it starts down here low in the lower extremity, the higher it goes, the more likely it is to embolize, especially if it gets above the knee. So if you have thrombosis in the femoral vein above the knee, you better be anticoagulated, because you're going to wind up with a what? A PE, pulmonary embolism. All right? Inflammation of the superficial veins, the great, the small saphenous, their contributors, is phlebitis. If there's blood clots in it, it's thrombophlebitis. And you call it superficial thrombophlebitis just because it's the superficial veins. You treat this with steroids, anti-inflammatories, and heat, and it usually resolves over a short time. Varicose veins are simply incompetent valves, and the great saphenous and the other veins. So you wind up with large varicosities in the lower extremities. Osteosarcoma is a wicked malignancy. It usually hits teenagers during their period of rapid bone growth. It is it's an osteoid tumor. It's made up of bone cells, mutated bone cells. And 60% of osteosarcomas occur in the distal femur proximal tibia. 60% of them. 40% occur elsewhere, like in the pelvis, vertebra, and maybe 20% occur in the shoulder. But 60% of them occur down around the knee. These things metastasize quickly, and because they're going to go to the lung, there's usually no coming back from that. What they look like, what an osteosarcoma looks like is that. So if you have a high school or middle school kid coming in, mom brings him in because he's been complaining of knee pain, he's on the football team. Every day he's complaining of knee pain, get a freaking x-ray. Just a plain x-ray. Get an x-ray. Even though it's probably just wear and tear from football practice, you never want to miss an osteosarcoma. Get an x-ray. Okay? This one right here is just ridiculous. You're never going to see that. The treatment for this is immediate amputation. Usually that day or the next day. And that'll be all she wrote for the thigh and knee. Any questions? Okay, well, let's go. You just going to walk over there.
No, I was just thinking about like some high school kid and see her team football practice, bam, and volleyball.
It's like, I don't know.
Play volleyball, and went into the doctor, missed it, and then they came back with the other butterfly problem. And then got transferred to
Oh, okay.
there's like 2 people who have cancer.
Oh, right. How, yeah.
No, I can take the number of the stars, like that's